Hey, Dr. Brady here with Concise, and I'm excited to announce our newest machine in the office, our SoftWave Tissue Regenerative Therapy machine. We're going to talk about what it is, how it works, and how it will help you. Absolutely. After months of waiting, it is finally here. And a lot of people just don't know about this service, but it's the most conservative, least invasive option for you in the world of tissue regenerative therapy. So stay tuned, let's get started, and let's talk about it. So a lot of people are asking me, why am I bringing this into the office here? I've experienced firsthand myself about a year ago a chronic issue that I was experiencing. And while I could go down the route of drugs and injections like cortisone and stuff that doctors were recommending me, I could not get over this hurdle of a soft tissue injury that I was experiencing. And when I received treatment on this, I sought out a clinic that had it, paid for it, and it changed the game for me. And I knew instantly that I had to bring it in. So after months of waiting, it's here and now it can help you. And this is what I see with patients. Whether it's knees, we got plantar fasciitis, we got shoulder issues on people, elbows, wrist, all these joints, we help them with chiropractic. And it's good because we can help them and we get them by. But in the reality, when a joint is in a degenerative state, it's going to continue to degenerate, and we can hold it off and kind of minimize, but over the years, what's going to happen over 10, 15, 20, 30 years down the road, the longevity of that. And here's an important stat that I've come to know and learn, and what the stats say is that somebody who seeks out pain management and their first source is a medical or primary care physician, they are 28 times more likely to end up down the inevitable route, it seems like, of drugs for opioids to manage the pain is the first. Second is then doctors will recommend injections like cortisone injections or steroids just to mask the pain, get you by for 6 months. Or then they recommend surgery if those kind of fail, and then it's a full total joint replacement. All of these things, when you show up to a medical doctor and when you're 28 times more likely to do that, what if we stepped back and gave a better option? And that's where the SoftWave Tissue Regenerative Therapy machine comes in as the most conservative, least invasive, to be able to flip the reversing of the degeneration that's occurring and then help it regenerate. So let's talk about how it works. So this here is the applicator head, and how it works is there's a spark inside, and when that spark happens like so, what it's doing is it's sending a non-focused parabolic sound wave basically through this membrane that's filled with fluid. Now we use a conductor, which is ultrasound jelly, to then travel that spark through the membrane, through the top layer of tissue, and then deep into musculoskeletal tissue, treating cartilage, tendons, ligaments, muscles deep down in the joint and on the bone there to get massive healing and stimulus. Now there's 4 things that are important that occurs when we treat over an area of tissue. And you might be wondering, is this for me? So let's talk about the 4 things. The first 3 things that occur actually are instant like that. So right away, the first thing is that it clears out when that sound wave goes through old dead cells. These are called senescent cells. It basically wipes them out. Think about scar tissue and this junk that's in there, we need to get out first. Second is then what happens is then as it travels through, it increases blood flow by up to 300%. Absolutely crucial because you need nutrients in the area first and foremost, even to get healing to occur. And then the third thing that happens when it travels through there is that it modulates the inflammatory response, decreasing the pain and then also signaling to a really important cell inside called exosomes. Now, exosomes are when those get stimulated. That's what actually stimulates the 4th thing. And the most important is the local stem cell migration that occurs over the next weeks and months to come. Now, we think of it this way. We clear out the garden bed to basically get the most life and growing. Now, in comparison, you might have heard of stem cell injections. They're great, they work, rather expensive, this comes in way lower, but here's the difference. A stem cell injection, whether harvested from fetal cells or umbilical cells, or if you pay even more premium to do a local stem cell extraction from yourself, they stick a big needle into your bone marrow, deep in the bone, extract your local stem cells, and then inject it into a site. That's better evidence than from umbilical or from fetal cells, from non-local sources, but when that's injected in, it's just shot into the joint, and over like 6 months, then it kind of starts replicating and turning into tissue. There's definitely evidence, and it does help. While it's more expensive, it's more invasive. You got to stick needles in you. There's recovery from that, especially if you extract from your own stem cells. But this is absolutely no needles. And more importantly, it creates the perfect environment far before the stem cells reach the area, which is more important, so you can actually get better healing and results. Again, clearing that garden bed out so that life can grow. So instantly those first 3 things happen, and 80% of people pop off this table here and they say, That is phenomenal. It moves better. It feels like you just put WD-40 in the joint there. And as well as they might say, like 100% of the pain is gone. Now, over the sequential treatments, there are protocols to follow to get the maximum stem cell recruitment to the area. And that's the best and most benefits to ensure that we flip this degenerative joint into a regenerating joint there for you. So let's talk about all the things that it's good for and how it can help. Most common, shoulders, knees, absolutely. People questioning, like, should I get an injection, cortisone shots? Even if maybe you have, we can absolutely help that and stop so you don't have to keep getting cortisone shots there and they're telling you, let's see how long you last before surgery. No, we need to nip it now, reverse the degeneration, get it regenerating there for you. Or if you're far before that, or even after surgery, we can absolutely treat post-surgical cases, which no doubt there's already scar tissue in there and it has to be cleared out to help the movement, mobility, and the future 10, 15, 20 years down the road to make sure that you avoid another surgery potentially there. Okay, so we're talking shoulders, knees, hips, bursitis, we got elbows, we got wrist, soft tissue injuries, contusions. We even get into the realm of like plantar fasciitis and the benefits there to increase the blood flow to just get you healing quicker and faster there. We got neuropathy cases, tons. It's great for scars, actual physical scars on the skin. Wide variety here down in the TMJ joint, and as well as we can treat everywhere over the spinal column for degeneration, the disc herniations. Think about down the cervical, thoracic, lumbar spine, down the SI joints, tons of things here. So is this for you? I think it's worth a shot because this is the most conservative, least invasive option out there for people. We're super excited to have this technology here in the office. Now, if you want an appointment, just reach out to us, call us, email us, information will be down below. We can't wait to serve you to help you with tissue regenerative therapy.